Hey guys, this is Dr. Diana, and I'm basically a dentist with a master's in public health. And I would like to thank CAAPID for inviting me to one of their episodes today. So, I'm here to talk in brief about public health and how dental aspirants can actually utilize public health to their benefits. So, let's delve in without further ado. We'll look at two main things initially. So, what exactly is public health, and what are the different public health courses that are available for dental aspirants? So, the first thing, what exactly is public health? So, public health is the art and science of preventing disease and prolonging life with the help of organized community efforts. This is just the basic understanding. So, what do we mean by this? Public health, how it differs from medicine is that medicine talks about reactiveness. What does someone do when someone has XYZ problem? What do we do when someone needs treatment for XYZ disease? In contrast, what we do in public health is how can we prevent XYZ from happening? How can we make efforts to prevent XYZ from affecting someone's life and things like that? It's a very vast topic. It's a really interesting proactive subject, if you can put it that way. So let's talk about what are the different certifications available for dentists who are interested in public health. First and foremost, in dentistry, we have a public health module, a public health dentistry module, at least in India. And not all of us like the subject, to be honest. It's kind of dry and a little boring, and we kind of have this basic understanding about public health from what we learn in dentistry. What I would like to tell everyone who's watching is that public health is actually even better than that. It is even more interesting than what you actually learn in dental school. And the essence of public health is evident when you do a master's in it. For those who do not wish to go into the clinical side of dentistry, you can choose public health. For those who want to do something for the community as a whole, you can choose public health. For those who want to do dentistry, but they have some licensing exams to pass, or they have some exams to pass and they don't know what to do during the interim, public health is for you. You have to have a basic knowledge about public health. You have to have a basic love for public health before entering. But if you think public health is for you, if you think that this is something that you might be interested in, I would suggest you to give it a shot. What are the different certifications that are available? What are the different degrees that are available? So the most common is MPH, or the Masters in Public Health. The second is Masters in Science and Public Health, that is a MSc degree. And the third is Dental Public Health, which is more specific for dentists. And there is finally a certificate in Public Health, which is a very shorter duration course compared to public health, but which gives you again an essence of the whole subject. These courses are available within India as well as outside. So let us look at why you would choose this degree within India and why you would choose it outside India. If you want to choose this degree within India, the scope is little bright if you want to work in India, because you learn geographically significant, culturally significant aspects of public health. You are trained to suit jobs that are available within India. But if you want to learn abroad, if you want to broaden your scope, if you want to work outside of India, if you want to know the situation of public health outside of India, and if you want to have a general understanding of the global public health status, then the best idea for you is to go and do it abroad. And which are the best countries to do it? For example, I finished my dentistry in 2015 and I did my public health in the United Kingdom. I did it in London Middlesex University, and it was one of the best experiences in my life. It was the most enriching 1.5 years of my life, and you could as well choose among a few different countries. And according to me, I would say the top countries that you could choose from is the US, the UK, New Zealand, Australia, Canada. um, uh, Probably these are the top few countries that you could study public health from. And of course, there are other countries as well which you could explore, and that's up to you, totally up to you. But I would suggest the best way to go about it is to look at the job opportunities which are there. And let me tell you a little brief about why I took public health. So basically, for me, I was so used to seeing so many dentists in India. Like in India, if you want to be a dentist, you should be ready to compete with the other 5 or 6 dentists in your own street. And I wasn't up for it. I mean, it's a nice challenge, and some of you will want to do it, but personally for me that was not my cup of tea. And I didn't want to be competing where there was too much competition, not because I thought I was not capable of doing it, but because I wanted to stand out, and I wanted to do something different. And for me, the best thing I could think of was public health, because of my love for community medicine, my love for community health, for my love to make healthcare accessible to the masses. So in especially in a country like India, and especially when you're doing a course like dentistry, you go for a lot of camps outside Chennai, you go for a lot of camps outside your native, to provide dental treatment. So in one of these camps, in multiple of these camps, I had this feeling that these people are not getting the help they needed, they're not getting the healthcare that they needed. And we had to go in, and we had to do something to make it accessible to them. We had to do something a little extra to make healthcare accessible to them. And that one small thought led to this passion, innate passion for public health. And that's exactly how I got into public health in the first place. And I decided to choose UK to do it because I did a lot of background research, and I felt the module was very engaging, and I'm very very happy about my decision. And in UK, it's a 1 year course with a huge research component. So when I talk about a research component, it means that 95% of your studies is through the research that you do. So at the end of this 1 year, you have a thesis to submit, and that will be a research based thesis. And based on your performance in this thesis, you will be given your degree. So public health has a lot of modules in it, such as epidemiology, public health policy, biostatistics, health economics, policy and prevention, and a lot of other things. So you could choose to specialize in one of these. You could choose any one of these modules as your key module and specialize in that especially. And for those who want to do something very related to dental and dentistry, you could choose to go into dental public health, which talks about oral cancer, which talks about oral diseases and how to prevent these diseases. And like I said, I told you why I did my course in the UK. And like I said, it was a 1 year course, and it finishes off with the thesis that you have to work on. And so how exactly can you use public health as an interim before you finish your other courses or other licensing exams? So for example, in UK, you have to pass the ORE, or the Overseas Registration Exam, if you want to be a practicing dentist in the UK. So what people usually do is take the part 1 of the ORE in India, like they prepare for it rather in India, and they come to the UK just to sit for the exam. And part 1 is the theory exam, and it probably costs you 1 lakh rupees or £1,000. And post which you have to sit for the practical exam, that is the level 2 of the ORE. And you have to go for a few classes for it, and it costs you around 3 to 4 lakhs to do it. And that is excluding the training that you undergo for it. So all this can be done potentially when you are studying for your public health, when you are doing your public health. So the best part of it is that you can choose to do public health simultaneously when you are preparing for your licensing exam, when you are in process to do some other course, or when you're in the process of doing something else that is more clinically oriented. So at the end of the day, when you finish your public health, you're already qualified to practice as a dentist, and your standing in the market, your standing in the society with an additional public health degree is far superior than someone who is just a dentist. Okay, so you have a lot more opportunities waiting for you, you've got a lot more experience, you've got a better designation, you've got better status, and there are a lot of other things, and you can help the community much better, which is the most important thing. So so these kind of little things are what makes public health stand apart. And for someone like me, I chose not to go into the clinical side. I chose to be purely into public health. So for me especially, I chose public health as my main subject, as my main focus area, and I had to leave the clinical side behind, which I actually don't regret. So right now I'm heading the clinical department in a healthcare IT company, which is based in the US. So like you see, there's a lot of opportunities waiting for you as a public health professional. There are so many things you could do. You can get into government services, you can get into the private sector, you can do a variety of things with this degree. And probably the scope for discussing those things are in another video, but I just want to let you know that public health is a very, very, very good way to get out of the clinical side, but also it is a good way to stay in touch with your subject, and to better your skills while you are preparing for your license exam, or while you are preparing to clear dental exams. The best thing you can do to utilize that time is to get into a public health degree. And for those who are aiming to do so, do your own research, look into different countries, look into different courses, look into the modules, look into what they're offering, and then decide which is the best for you. So a course in India that lasts for 2 years might be better for you, and a course that lasts 1 year in the UK might be better for someone else. So that decision has to come from you, and you would know that only by research. Keep constantly looking at different things, keep constantly looking at different opportunities that are available, different courses that are available, and at some point you yourself will know what exactly you're interested in, what exactly you want to do, and all the best for it. So possibly I would elaborate more on some other video, but for now this is it. I hope it was useful. Thank you so much.